Time moves on and no one can stop it, and aging comes to everyone naturally. However, not everyone can recognize the subtle signs that indicate someone may be in the final years of their life. Small changes in behavior, health, and mood can be important signals that we shouldn't ignore. Understanding these signs not only helps you take better care of your loved ones, but also makes you aware of the factors affecting your own health and longevity. When we pay attention and learn to listen to our bodies, life can become longer and more meaningful. Let's explore 5 key signs so you can stay healthy and not miss important signs from your loved ones in their later years. 1. Significant weight loss, an important sign of declining health in the elderly. Unintentional weight loss in the elderly is one of the most obvious signs that their body may be nearing the final stages of life. Although it may not be immediately noticeable, this weight loss carries significant meaning and could signal a profound change in overall health. In this article, we will go into more detail about why weight loss in the elderly is noteworthy and how to recognize this sign in a timely manner. Causes of unintentional weight loss. Sudden and unintentional weight loss in the elderly can result from many factors, ranging from the body's inability to absorb nutrients properly to the decline in the function of vital organs. As the digestive system weakens with age, the elderly find it harder to digest food and absorb nutrients. This not only causes energy deficits, but also reduces the body's ability to maintain important functions, including the immune system. One of the primary factors contributing to weight loss is a decline in the ability to absorb essential nutrients, such as protein, vitamins, and minerals. When the body does not receive enough necessary nutrients, muscles begin to weaken, leading to muscle loss, which reduces strength and mobility. While muscle loss is a natural part of aging, when this process happens too quickly and intensely, it can be a sign of serious health conditions such as cancer, heart failure, kidney failure, or other chronic diseases. Weight loss and basic health. When the elderly lose weight quickly, their body no longer has enough strength to maintain daily activities, causing difficulties in movement, walking, and even performing simple tasks. Muscle loss makes it difficult for the body to maintain balance and necessary strength, increasing the risk of falls and injuries, which can lead to a vicious cycle of declining health. Additionally, weight loss weakens the immune system, making the elderly more susceptible to infections and dangerous diseases. When the body lacks energy and nutrients, the immune system cannot function effectively, allowing bacteria and viruses to attack the body. This makes the elderly more prone to illnesses such as the flu, pneumonia, or other infections, and slows down recovery from surgeries or medical treatments. Diseases related to weight loss. Many people think that weight loss in the elderly is a natural part of aging, but in reality, it could be a sign of serious health issues that need timely diagnosis and treatment. Chronic diseases such as cancer, heart failure, kidney disease, and gastrointestinal disorders can lead to rapid and uncontrolled weight loss. Moreover, psychological issues such as depression or cognitive decline can also reduce appetite, leading to missed meals or inadequate nutrition, exacerbating the weight loss condition. Furthermore, unintentional weight loss may also be linked to decline in the function of organs in the body. When the liver, kidneys, and other organs weaken, the body loses its ability to process food and metabolize nutrients like before, leading to nutritional imbalances. How to recognize and address weight loss in the elderly. Early detection of weight loss can help family members and doctors intervene promptly. If you notice that an elderly person is losing weight without a clear reason, pay attention to their diet, lifestyle habits, and other signs such as fatigue, reduced energy, and other health issues. Regular health checkups and necessary tests are essential to determine the cause of weight loss. Additionally, rather than forcing elderly individuals to eat more, families can focus on providing easily digestible meals that are nutrient-dense and easy to absorb. Small, frequent meals combined with protein-rich and vitamin-rich foods can help improve the elderly's nutritional status. At the same time, ensuring adequate hydration and maintaining a comfortable environment are also crucial for supporting overall health. In conclusion, significant weight loss in the elderly is not just an issue of appearance. It is a warning sign of their overall health status. If detected early, family members and doctors can intervene to improve the quality of life and help the elderly feel more comfortable in their final years. 2. Fatigue and extreme weakness. Warning signs of health decline in the elderly. Prolonged fatigue is one of the most noticeable signs when it comes to health decline in the elderly. In many cases, this fatigue cannot be relieved even with adequate rest. This could indicate that the body is gradually losing energy as its functional organs begin to weaken and the body enters a state of energy conservation. Fatigue and extreme weakness are not just ordinary feelings, but also warnings for serious health issues. Causes of prolonged fatigue. Several factors can lead to prolonged fatigue and weakness in the elderly. One of the main causes is a decline in the function of the body's organs. As the body ages, vital systems like cardiovascular, respiratory, and digestive functions no longer work as efficiently as before. This results in the body being unable to supply enough energy for daily activities. Fatigue becomes a response when the body is overworked to maintain vital functions. Specifically, when cardiovascular function weakens, the amount of blood supplying oxygen and nutrients to the organs decreases, causing tissues and muscles to lack energy. This makes the body feel exhausted even with minimal physical activity. Similarly, when respiratory function declines, the gas exchange process is limited, reducing the oxygen supply to the body, leading to fatigue. Moreover, fatigue can also be a result of decreased digestive function. When the digestive system no longer absorbs nutrients efficiently, the body doesn't receive enough energy from food, reducing vitality and causing fatigue. Chronic diseases such as diabetes, kidney disease, cancer, or liver issues can also contribute to prolonged feelings of fatigue. Fatigue and the energy conservation mechanism. As the body enters the aging process, one of its natural responses is to switch to an energy conservation mode. This means the body reduces unnecessary energy-consuming activities and focuses on maintaining essential life functions. This may reduce the elderly's ability to engage in physical and social activities, leading to feelings of fatigue and weakness. The body starts using energy more efficiently, which can make the elderly feel tired even without exerting themselves too much. Muscles weaken, mobility decreases, and simple tasks like walking or getting up become harder. This weakness becomes more apparent when the body lacks the energy to maintain normal motor functions. Psychological impact and depression. In addition to physical factors, prolonged fatigue may also be linked to the elderly's mental health condition. Depression is a common disorder among the elderly, particularly in their later years. Depression can make elderly individuals feel demotivated, low on energy, and disinterested in daily activities, leading to prolonged fatigue. When the mental state is unstable, the body also responds by losing energy, leaving the person feeling drained and uncomfortable. Fatigue and interventions. Recognizing prolonged fatigue and weakness early is crucial to improving the health of the elderly. If fatigue doesn't improve even with sufficient rest, the individual should be examined to determine the exact cause. Blood tests, cardiovascular, respiratory, and digestive function checks can help detect underlying health issues. In addition, the elderly need to maintain a balanced, nutritious diet to provide adequate energy for the body. Supplementing with vitamins, minerals, and protein can help improve overall health and reduce fatigue. Gentle exercises such as walking or restorative exercises are also essential, helping improve body resilience and maintaining muscle strength. Another critical factor is maintaining a comfortable living environment and reducing psychological stress. Providing opportunities for the elderly to engage in social activities and interact with friends and family can help improve their mood and reduce the fatigue caused by mental stress. In conclusion, extreme fatigue and weakness in the elderly are not uncommon, but if prolonged, they can be signs of serious health issues. Early identification and timely intervention are essential to improve the quality of life and health of the elderly. Care and close monitoring from family members and doctors can help reduce fatigue and allow the elderly to maintain their energy and health during their later years. 3. Cognitive disorders and emotional changes. Warning signs of mental health in the elderly. As people age, the body undergoes significant changes, not only physically but also mentally. One of the noticeable symptoms in the elderly is the onset of cognitive disorders and emotional changes. These signs may manifest in various forms, from forgetting simple things, feeling confused, to noticeable changes in emotions and behavior. These are crucial signs that require attention and monitoring to detect serious health issues, especially related to brain function. Cognitive function decline. Cognitive disorders in the elderly often begin with very mild symptoms that are not immediately noticeable. One of the most common signs is forgetting simple daily activities, such as forgetting names of acquaintances, losing objects, or forgetting important events. Initially, these events may seem like minor occurrences, but over time, they become more frequent and reduce the elderly person's independence in daily life. As cognitive disorders progress, the individual may feel confused in simple situations, unable to accurately perceive time, space, or relationships between objects and people. This not only makes communication more difficult, but also affects their ability to perform daily tasks, such as self-care, mobility, or using household devices. Causes of cognitive disorders. A common cause of cognitive disorders in the elderly is a lack of oxygen supply to the brain. As the body ages, blood vessels in the body, especially in the brain, may narrow or become less efficient at delivering blood and oxygen. The brain requires a sufficient supply of oxygen and nutrients to maintain its activity and cognitive function. When this supply is interrupted, brain cells can become damaged, leading to a decline in memory, thinking, and information processing abilities. In addition, chronic conditions like cardiovascular disease, diabetes, or cerebrovascular diseases can affect blood flow and oxygen supply to the brain. This increases the risk of dementia or Alzheimer's disease, two of the most common conditions causing cognitive disorders in the elderly. Emotional and behavioral changes. Along with cognitive decline, changes in emotions and behavior are signs that should not be overlooked. The elderly may begin to experience anxiety, depression, or irritability for no apparent reason. These emotions can appear suddenly and fluctuate, affecting their mood and ability to socialize. Additionally, there may be changes in behavior, such as repetitive actions, delusions, or impatience. These changes may cause the elderly to become difficult to approach or exhibit inappropriate behavior in social situations. This is a sign that the brain is no longer functioning effectively in regulating emotions and behavior, causing the person to lose control over their emotional responses as they once could. Impact of cognitive disorders on quality of life. Cognitive disorders and emotional changes can severely impact the elderly's quality of life. When they no longer have a clear sense of themselves or their environment, they may feel disconnected from the world, leading to loneliness and isolation. This exacerbates psychological issues like depression and anxiety, making their mental health condition progressively worse. Moreover, as cognitive decline increases, the elderly will face difficulties in performing daily activities, from self-care participating in social activities. This reduces their ability to live independently and creates a burden on their families and loved ones. The lack of awareness and emotional changes can also cause conflict within the family, raising stress and anxiety for relatives. Interventions and treatment. Early detection of cognitive disorders and emotional changes is crucial in preventing the progression of condition. Doctors can use tests and comprehensive assessments to determine the cause and severity of the disorder. For mild cases, lifestyle changes such as improving diet, increasing physical activity, and engaging in social activities may help improve cognitive function and emotional well-being. Additionally, psychological support, such as therapy and recreational activities, can help reduce stress and improve mental health. For more severe cases, doctors may prescribe medication to manage symptoms and help the elderly maintain a better quality of life. In conclusion, cognitive disorders and emotional changes are important signs to consider when assessing the health of the elderly. These signals indicate a decline in brain function and affect their daily lives. Timely detection and intervention can minimize negative impacts and improve the elderly's quality of life, allowing them to live healthier and happier in their later years. 4. Frequent infections and slow wound healing. Warning signs of a weakened immune system in the elderly. As people age, their immune system gradually weakens, making the elderly more susceptible to infections and causing even minor wounds to heal more slowly. Frequent infections and slow healing of wounds are common occurrences in older adults, often signaling that the body no longer has the same protective capabilities it once did. These issues can significantly affect their overall health and quality of life. Weakened immune system and its link to infections. The immune system is the body's defense mechanism against harmful agents, including bacteria, viruses, fungi, and other threats. When we are younger, the immune system effectively responds to and fights off these pathogens, helping the body stay healthy. However, as we age, the functions of the immune system gradually decline, a phenomenon known as immunosenescence. Immunosenescence makes the body more vulnerable to infections and slower to recover from illness. The elderly are more likely to develop respiratory infections, such as the flu, pneumonia, or urinary tract infections. These infections can last longer and lead to serious complications if not treated promptly. At the same time, a weakened immune system makes it harder for the body to combat new harmful agents, allowing bacteria and viruses to infiltrate and thrive. Slow wound healing and its causes. In addition to frequent infections, older adults often experience difficulty healing wounds, even minor ones. The wound healing process in the elderly is slower compared to younger individuals due to the diminished function of the immune system and the reduced ability to regenerate cells. When a wound occurs, the body needs white blood cells to clear and fight infection in the wound, as well as skin and tissue cells to repair the damage. However, when the immune system is not functioning optimally, the ability to fight infections and regenerate tissue is slower, resulting in slower wound healing and a higher risk of infection. Factors such as poor nutrition, reduced blood circulation, and underlying health conditions like diabetes or cardiovascular diseases also contribute to delayed wound healing. The more of these factors present, the greater the risk of infection and serious complications from the wound. Impact of frequent infections and slow wound healing. Repeated infections and slow healing wounds can have a significant negative impact on the health of the elderly. Infections not only cause pain but also reduce the ability to carry out daily activities, such as walking, eating, and self-care. Infected wounds can become a source of bacterial spread, leading to serious complications like sepsis, septic shock, and if untreated, can be life-threatening. Furthermore, wounds that do not heal properly can reduce the quality of life for the elderly. Ongoing pain and discomfort can lead to mental health issues, such as feelings of sadness, anxiety, and depression. This, in turn, worsens their overall health as an unstable mental state can affect recovery and the ability to maintain normal activities. Prevention and treatment measures. To reduce the risk of infections and slow wound healing, the elderly should focus on maintaining a healthy lifestyle and boosting their immune system. A balanced diet, especially one rich in essential vitamins and minerals, plays a key role in supporting immune health. Vitamin C, vitamin E, zinc, and omega, 3 fatty acids are nutrients that help enhance immunity and speed up wound healing. Additionally, light physical exercise is important for maintaining blood circulation and supporting the cell regeneration process. Maintaining good personal hygiene and protecting the body from harmful agents, such as bacteria and viruses, also helps reduce the risk of infections. If a wound occurs, elderly individuals need careful care, regular dressing changes, and close monitoring of the wound to detect early signs of infection. If frequent infections or slow healing wounds are present, elderly individuals should consult a doctor to determine the underlying causes and appropriate treatment. Doctors may prescribe antibiotics or treat underlying conditions, such as diabetes, to speed up wound healing and prevent recurrent infections. In conclusion, frequent infections and slow wound healing are concerning signs of the health condition of the elderly. These result from the weakening of the immune system over time, making the body less capable of protecting itself as it once could. To maintain good health and minimize these risks, elderly individuals need to care for themselves carefully, follow preventive measures to avoid infections, and properly manage wound care. 5. Changes in breathing and circulation, warning signs of health issues in the elderly. As people age, their bodies undergo many changes, including a decline in respiratory and circulatory functions. These changes can affect the ability to breathe and circulate blood, leading to symptoms such as shallow, irregular breathing, and shortness of breath, even with minimal physical activity. These are warning signs that the body is gradually shifting into an energy conservation mode, reducing circulation to the limbs and non-essential organs. These changes are not only a sign of the natural aging process, but may also indicate underlying health issues that older adults should be mindful of. Decline in respiratory function and shallow breathing. The respiratory system in older adults gradually loses its flexibility and efficiency. The muscles and tissues of the respiratory system weaken, reducing the ability of the lungs to expand and absorb oxygen. Shallow breathing is a noticeable symptom when lung function declines. Older adults may feel short of breath even during simple tasks, such as walking or working for a short period. This sensation can make them feel more fatigued and stressed as they struggle to provide enough oxygen to their bodies. One primary cause of shallow breathing and difficulty breathing is a reduced ability to exchange gases in the lungs. When the alveoli in the lungs lose their ability to effectively absorb oxygen, the amount of oxygen entering the bloodstream decreases, leading to oxygen deficiency in the body and resulting in symptoms of breathlessness. This condition can also increase fatigue, as the body does not receive enough energy to maintain normal activities. Changes in circulation. Along with a decline in respiratory function, the circulatory system also undergoes significant changes as the body ages. A common change is a reduction in blood circulation, especially to the limbs and non-essential organs. When the circulatory system is unable to supply sufficient blood to parts of the body, the limbs, such as hands and feet, may feel cold, numb, or weak. These symptoms are more pronounced during rest or when the body is not physically active. The reason for reduced blood circulation is that blood vessels become stiffer and narrower with age. Blood vessels in the body tend to harden, reducing their ability to expand and contract. This makes it difficult for blood to flow efficiently, particularly in extremities, such as the hands and feet. When blood is not adequately supplied, the cells and tissues in the body do not receive enough oxygen and nutrients, leading to symptoms such as fatigue, weakness, and potential health issues like swelling and cramps. The body shifts into energy conservation mode. As the body experiences declines in both respiratory and circulatory functions, it begins to shift into an energy conservation mode. This means that the body will reduce the amount of blood and oxygen supplied to non-essential organs and systems. Instead, the body prioritizes energy for more vital organs, such as the heart and brain, to maintain basic life functions. This shift can result in feelings of fatigue and low energy, especially when the body is unable to sustain normal activity due to insufficient oxygen and nutrients. Reduced circulation and respiratory capacity can also increase the risk of cardiovascular diseases, strokes, and other health issues. When the body does not receive enough oxygen and nutrients, cells and tissues may become damaged, potentially leading to a decline in the function of vital organs, including the heart and brain. This creates a negative cycle, where the body is unable to recover and maintain a healthy state on its own. Preventive measures and treatment. To maintain effective respiratory and circulatory health in older adults, a healthy diet and an active lifestyle are essential. Older adults should eat nutrient-rich foods, particularly those that support cardiovascular health, such as leafy vegetables, fresh fruits, seeds, and omega-3 rich fish. Foods high in vitamin C and E can also help protect blood vessels and support respiratory health. Light exercise, such as walking, yoga, or breathing exercises, can help improve blood circulation and respiratory function. Exercise not only strengthens the muscles, but also stimulates blood circulation, helping to improve the flow of oxygen and nutrients to organs throughout the body. When experiencing symptoms such as shallow breathing, shortness of breath, or poor circulation, older adults should consult a doctor for timely advice and treatment. Physicians may recommend treatments to improve respiratory and circulatory function, including medications, physical therapy, or other medical interventions. In conclusion, changes in breathing and circulation are common signs in the elderly and reflect a decline in respiratory and circulatory function. These signs need to be recognized and treated promptly to protect the health and quality of life of older adults. Maintaining a healthy lifestyle combined with proper medical care can help elderly individuals cope with these changes effectively. Final thoughts. Early recognition of declining health signs in older adults is crucial for better physical and mental preparation. By understanding these changes, individuals can proactively manage their health, consult doctors promptly, and implement appropriate measures to support their loved ones. This also helps create meaningful moments together, strengthening relationships and leaving behind cherished memories in the remaining years.